Welcome to MD Newsline, Rachel Sood. Can you please introduce yourself to our audience?
Yeah, thank you so much for having me today. So, my name is Rachel. I am a diabetes nurse practitioner from right outside New Orleans, Louisiana, in the United States. I'm also a certified diabetes care and education specialist, and I own a practice called the Diabetes Collective. So, we are a diabetology practice, and it's just a really exciting time. I'm here for the American Diabetes Association 85th Scientific Sessions here in Chicago.
Awesome. Yeah, the idea of a practice that focused solely on diabetes specifically is really interesting. Tell me a little bit about what that entails and how it's different from the route that people would usually take.
Sure. So, diabetology is really this transformative movement that's coming in globally, and it is here in the United States. There are certification programs to obtain and be a diabetologist. So, when we talk about diabetology, we're talking about the identification, treatment, and management of diabetes across the spectrum. So, that entails anyone that has diabetes or is at risk for developing it, whether it is type 1, type 2, whether someone has pre-diabetes or even gestational diabetes, and we're, treating women. And then also, of course, people need a lot of and use diabetes technology, and they need support in that aspect. So,
So tell me a little bit about how you approach your initial assessment and risk stratification for new diabetes patients and the clinical factors that you prioritize when you're managing plans for type 1 and type 2.
sure. So, when a patient comes in to see me, I never just assume like what kind of diabetes do they have? Do they have pre-diabetes? Do they have type 1? Do they have type 2? And how do we find that out? Many patients will come in with a diagnosis, usually from a prior practice. Typically, in the United States, we have the practice of endocrinology, which is just, looking at and encompassing the entire endocrine system. But when you start looking just at diabetes, you're looking more focused at metabolic health and the pancreatic function, and if these patients are still able to produce their own insulin and if they're using it appropriately. There's a lot of genetics, honestly, that goes into this, and diabetes has changed. So, this is actually a fun question that you have for me. So, historically, people used to really say type 1 looks a certain way, and type 2 is, a disease of lifestyle. You're overweight and you eat too many donuts and, you overeat. But really, in fact, we have many people with type 2 that have a genetic predisposition to this, that this is a metabolic disease, and it can be inherited. And some people that have type 2 are not overweight. I have multiple patients that way. There are people with type 1 that can be overweight. And so I think a lot of people get misdiagnosed. So when patients come into my practice, I always screen them for type 1. Type 1 is an autoimmune disease. So we do look for multiple autoantibodies. It's easy to do on a blood test. That way we can identify, okay, what are we treating first before we go in and start prescribing medicines and making recommendations. And then kind of going from there, we can use different therapies tailored to what type of diabetes this is or what type of diabetes we're trying to prevent. Are we delaying a progression to type 2? Is this person at risk for type 2 diabetes? Or is this patient someone that is in an early stage type 1 and they may need or be on full insulin dependence if we don't act now? So really just identifying what is this and then kind of tailoring, the plan of care thereafter.
What type of patients do you see most often in your practice?
I see mostly, I would say about 60 to 70% are patients living with type 1 diabetes, or about 30% that are pre-diabetes that could potentially be type 2 or are type 2 and they're not diagnosed appropriately. Like they're misdiagnosed. They have type 2 diabetes and somebody didn't know how to diagnose type 2.
Hmm.
It's sad.